Senator Rand Paul of Kentucky is now my guest. All right, Senator, I imagine that you got to see Kathleen Sebelius today. Have you changed your mind about wanting her to resign as a result of what she testified to today?
You know, I think government's inherently inept, but I think this brings it to a new level of incompetence. I can't imagine how she could continue in her job. I think she should resign really from mere embarrassment. I've never seen anything this bad. And here's the thing is that when the president said you could keep your doctor, and now we find out 2 million people are going to lose their doctor and lose their insurance.
At least.
I just can't imagine how that they can be proud of what they're doing and how he can't say that he's going to hold someone responsible.
Well, she says she takes full blame, that she told the president we were ready, and that clearly she was wrong. But you say the biggest whopper in this whole thing is what?
Well, I think that saying people you can keep your own doctor is the biggest whopper, because really it turns out that you can't, and they knew it. They specifically added a line in the bill that said your insurance would be discontinued. And really you wonder what their motive here is, that maybe there's going to be no more individual market, and the only thing left is going to be 4 plans, 4 government plans, no other choices. So before Obamacare, we had hundreds of choices. Now we're going to have 4 choices.
But also, Senator, you were really hot on the idea that they said that this was supposed to reduce the deficit. What's it going to do now?
It's going to cost us $2.6 trillion. I think they always knew that. And I think nobody on the face value believed that Obamacare, which is going to give free health care to 15% of the people, was not going to cost anything. That on the face of it was totally unbelievable. And the interesting thing, though, is that they actually got a government agency to score this initially as a savings. But now, I think as people are looking at this, they're knowing it may cost a couple $1 trillion.
What do you expect the president to say? Because just about an hour and a half from now, as we were just mentioning with Bret Baier, he's going to be up in Massachusetts. Now, remember, last week, this is a live shot of where he's going to be. Last week, he diverted and talked about immigration, and that really went nowhere. Now he's talking about health care on the same day that Kathleen Sebelius is grilled. What do you make of it?
I think he'll show up and he'll say, oh, but I'm going to get you better health care. You will lose your doctor. You will lose your insurance, but you're going to get better insurance. Here's the problem, though. The best insurance is what the consumer wants. It's what the patient wants. It's what you as an American should get to choose in a free society. It shouldn't be what the president tells you should want. So really what this is about taking freedom away from patients to choose who their doctor is. He's going to tell you which plan you can have. And if it turns out that your insurance is better than any of the 4 plans that he's offering, then he's going to tax you. I think if the American people knew what was really behind Obamacare, they would have overwhelmingly voted against this president. But he was able to cleverly allow the rollout to happen after his election.
It remains to be seen if he does any further delays to help Democrats in the midterm elections as well. I got to bring you to another topic, which is that you have promised to hold up the nomination of Dr. Janet Yellen as the chair of the Federal Reserve. Why?
For about 3 years, we've had a bill to audit the Fed. It passed with all the Republicans in the House and 100 Democrats. Overwhelming bipartisan support. I think the American people want oversight of the Federal Reserve, and it's been held hostage by Harry Reid for 3 years now. All I'm doing is saying, I'll let you vote on Yellen when you let the American people vote on transparency and auditing the Fed.
So you say the Federal Reserve does not lead prolonged secrecy? What do they keep in secret?
Well, quite a bit. All of monetary policy, all of quantitative easing, trillions of dollars changing hands. And I think what the American people want to know is, are people personally profiting from this? There's a revolving door from big money to the U.S. Treasury, back onto Wall Street, back into the Federal Reserve. The same set of people are going in and out. And then when they come out of government service, one recent Secretary of the Treasury made over $100 million his first year out of government. You got to wonder, does that have anything to do with some of this policy that's not open to the rest of us? Should we not all be aware of this? Should there not be transparency? I think there should.
All right, transparency with a capital T. Senator Rand Paul, thanks so much for your time today.
Thank you, Gretchen.